Hello, everyone. This is Anita Martell and Melissa Gibson. We're from DPH MCH, and today we're going to review MCH Coordination Catalyst Planning and Reporting System. We'll be using the user guide, so please follow along if you have it with you. And we will be using the Catalyst system on the computer. If you have a laptop or access to a computer, please follow along on the computer if you are able. You'll be using the link ky.sequest.us/home/default.asp. Look at your table of contents. Under titles, if you ever have a problem or a question with Cataylst, if you look at your titles on page 2 of your user guide and find the subject that your question falls into, then find the corresponding page number, you will be able to answer your question. If you don't want to go through this process, by all means, email me. It's the easiest way to contact me because I'm not always at my desk. But the quickest way is to look at page 2 on your user guide, find the subject, find the corresponding page number, and you should be able to find the answer on your own. Page 3, Cataylst for the new user. The purpose of Cataylst is designed as an introduction for the Kentucky Maternal Child Health Program, or MCH, and for MCH coordinators new to the reporting system. It is not meant to give you an overview of the entire system. However, it will allow you to meet your MCH reporting requirements and facilitate further exploration of the system. What is Cataylst? It's the web-based reporting and monitoring system originally developed and used by Washington State. It has subsequently been adopted for use by several other states, including Kentucky. Who to contact if you need assistance? Send your questions to the MCH Coordinator email box at mchcoordinator@ky.gov. and the appropriate person will contact you as soon as possible. Or you can send your questions directly to me at Anita, ANITA.Martell, MARTEL, @ky.gov. What you need to get started. The link for Cataylst is http://ky-catalyst.sequest.us/home/default.asp. After receiving the new user guide, contact KDPH MCH for user ID and password if you do not already have one assigned. System requirements. You will need a computer, an internet connection, a web browser such as Internet Explorer or Mozilla Firefox, either of which are preferred, and your MCH Cataylst User's Guide. Logging into Cataylst. Step 1, open your web browser and go to the Cataylst link. Step 2, this web address will lead you to the screen, to what you see on the screen. Step 3, type your user ID and password in the respective boxes and click enter. Also, a little sidebar here. It's a good idea to save the Cataylst link to your favorites file or bookmark it so that you don't have to type in the link every time. When to access Cataylst. Cataylst is accessible whenever you need to utilize the system. Because Cataylst is web-based, users can access the system any time of day from any location. All you need is the web address, your user ID and password, a computer with an internet connection, a browser such as Internet Explorer or Mozilla, and the MCH Cataylst User Guide. Welcome to MCH Cataylst. If you see the welcome screen on this screen, you have successfully entered Cataylst. If your login is unsuccessful, Cataylst will prompt you to attempt your login again. If your screen is different than what is shown here, go to Select Program on the far right side of your toolbar and choose MCH from the drop-down menu. If you see Welcome to MCH Cataylst, you are in the right place. Changing your password. Step 1. From the blue toolbar, select Home and then your profile. Step 2. The screen will appear. Step 3. Enter your new password, confirm the password, and make any updates to your email address and phone number as necessary. When to change your password. Users are requested to change their password every few months. Passwords should be at least 9 characters long and a combination of letters and numbers. However, we do not require that you change your password because you're not using secure information. You're not using HIPAA information, for example. On page 7 in your user guide, you will see the MCH Coordination Program LHD work plans, the MCH goals, domains, and activities packages chart. The MCH Coordinator Work Plan is developed from the goals and activities listed in the packages chosen by your LHD. This work plan needs to be completed by you and your MCH team if you have more than one person, using input from your director and your finance administrator. Your director must approve the final work plan and projected budget by package. This is accomplished by sending an email to mchcoordinator@ky.gov from the director's email address, telling us that the work plan and projected budget are in Cataylst and have been approved by them. KDPH will review and place the final approval note on your LHD's work plan file in Cataylst. Below is the list of goals, or MCH Title V domains, and activities, or packages, that are available for FY17. The goals and domains are IM123, perinatal infant mortality. The package associated to that goal are Safe to Sleep for community partners, Safe to Sleep for child care providers, prevention of abusive head trauma, and cribs for kids for community partners. The next goal, the next goal is PN121, women and maternal health. The associated packages for that goal are prenatal care tracking and healthy babies are worth the wait. The next goal is PED122, children and adolescents. Those packages include bullying prevention for schools and communities, coordinated school health, fluoride varnish for children through 5th grade. The last goal is MCH 124, cross-cutting. The associated packages for that are Baby and Me are smoke-free and 100% tobacco-free schools. Steps for developing your work plan in Cataylst. Step 1. After reading each of the MCH package guidelines, making your selections, go to Contract Management on the blue toolbar and choose Work Plans. Step 2. Make certain that your LHD is the default contractor and select the current contract year, in this case FY17, and then click the Find button. Step 3. Select the goal for your first package from the drop-down box. Step 4. Choose the activity or the package name from the drop-down box. Remember, at least one package from the IM 123 perinatal infant mortality must be chosen for the work plan. Step 5. Click on the New button to the right. This will take you to the actual work plan page. Step 6. In the Goal Activities section of the work plan page, select the appropriate goal from the drop-down box. Step 7. Choose the activity or package from the drop-down box. The activities that are associated with the goal you selected will be your only activity choices. Choose the activity or package that reflects the choice of your LHD. Step 8. Enter the number of events, allowable events and activities listed in the package guidelines anticipated for the activity for the fiscal year in the box to the right of expected number of events. Leave estimated time blank. We are not tracking your time. You will be tracking your time. Your director, your finance administrator, your timekeeper, you will be doing that internally. We will not be tracking your time, so please do not enter it in Cataylst. Step 9. Enter a projected cost for all package-related activities for the fiscal year in dollars. For example, 1, 2, 3, 4, 5 instead of $12,347.78, because commas, decimals, and dollar signs, as well as other special characters, cannot be used in that box. Step 10. Planned closeout month default is June 30th being the last day of our fiscal year. Therefore, if you plan to end an activity prior to June, you will need to change the default month for that activity to reflect the plan. For example, school ends in May, so if you're doing coordinated school health, you might want to change your default month to May. Step 11. Enter a SMART objective for your package, keeping in mind that it must be specific, measurable, achievable, relevant, and time-bound. For example, the LHD will increase the number of schools in the service area that implement 100% tobacco-free campus policy by 50% by May 1st, 2017. Refer to page 12 for SMART objective examples for each package. Step 12. Select Audience or Next from the blue work plan box on the left side of the screen. Step 13. Under Target Audience, select audience categories that are appropriate to the package being entered. These categories are listed on the first page of all package guidelines under Target Contacts. Under Estimated Number to Reach, enter the projected number of people you expect to reach during the year through the package related activities and events. In this example, 8 schools were entered. In our example on the screen, 150 LHD staff was entered. Click on Save. Once you have saved this entry, the system takes you back out to make your next work plan entry. When all goals, activities, and budget projections have been entered using these steps, you can pull up a work plan summary to make certain that all activities to be used during the fiscal year have been entered into your work plan. As you complete this process, a list will appear at the bottom of the planned activity page. The first page you come to after selecting work plans from the contract management menu. This is an indication that the work you have entered was properly saved. If you have entered activities in your work plan and there is no list developed at the bottom of this page, your entries did not save and will need to be re-entered. The checks under approved mean the packages have been approved and are active. The X means the package is not approved or the LHD chose to change their package choice at some point during the current year and this package is no longer active for them. This is the most likely scenario. The following is a list of the MCH goals or domains with related packages or activities and examples of SMART objectives. You will need to create SMART objectives that are tailored to the needs of your community and LHD. The goals: IM 123, perinatal infant mortality. The packages: Safe to Sleep for child care providers, Safe to Sleep for community partners, Prevention of abusive head trauma, and Cribs for kids. Examples of SMART objectives: we'll do one. We'll do Safe to Sleep for child care providers. LHD will provide 6 child care providers out of 9 in service area with safe sleep education and most current recommended materials to share with its families by December 31, 2016, and will be on their lists of resources for parenting group presentations. That is a SMART objective. Specific, measurable, achievable, relevant, and time-bound. And you can go through the rest at your leisure. MCH structure, goals, and activities. The goals for MCH were developed from state priorities identified in the Kentucky Needs Assessment conducted in 2015. These priorities were linked to national performance measures in accordance with the Title V block grant. You can access this document at http://ky.gov/DPH/MCH/default.htm. Each of the goals below represents one of the required domains, or MCH population category, of the Title V block grant. These are found in italics in the activities and in the reporting requirements sections of each one of the package guidelines, as well as in the administrative reference, which can be accessed at http://chfs.ky.gov/DPH/slash/ARLHD.htm. The goals are as followed. IM 123, perinatal infant mortality. PN 121, women and maternal health. PED 122, children and adolescent health. MCH 124, cross-cutting. As local health departments strive toward meeting national public health standards, it is important to create objectives that are specific, measurable, achievable, relevant, and time-bound. or SMART. Refer to page 12 for examples. All services funded through the Kentucky Title V Block Grant must link to state and national performance measures as outlined in the Title V Block Grant document at the above link and described specifically in all package guidelines. Title V envisions a nation where all mothers, children, and youth, including the Commission and their families, are healthy and thriving. The mission of Title V is to improve the health and well-being of the nation's mothers, infants, children, and youth, including children with special healthcare needs and their families. Outputs, events, reporting MCH coordinator activities in Cataylst. It is best to enter activities into Cataylst as they occur. Monthly is the minimum required to enter activities. All output entries must be completed by the 20th of the month following the month being reported. Steps for entering activity results. From the blue toolbar, select Contract Management and go to Outputs Events. Step 2. In order to begin entering activities for the packages, the first entry for each package selected will have to be chosen from the drop-down box. Once a package activity has been updated and saved in the output journal, you will be able to select the activity choice from the menu on the page. Step 3. To get started, select your agency as the contractor. Select the contract year. Select the goal and activity appropriate to the package for which you wish to make an entry. Our goal is IM 123 is the goal, and Cribs for Kids is the activity, and so forth. You will notice that some of the package names in the activity drop-down have an asterisk in front. These are the packages that were chosen for your LHD in the work plan, and they are the activities for which you must report. Click New. This step will need to be repeated until you have entered the first activity for each and every package chosen on your work plan. The results screen outputs, which is the first of 4 screens. Step 4. You are now on the results page of Outputs Events. There are 4 screens associated with each activity in Outputs and Events. Outputs, Key Partners, which is optional except for the Cribs package, Media, and Evaluation. You will be on the first screen, Outputs, indicated by the green arrow, after clicking on New. Use these screens to report allowable events and activities described in each package's guidelines against what was planned in your work plan. Step 5. On the Output screen, select a month. Entries must be completed by the 20th of the month following the month being reported. Step 6. Enter the actual number of events for which this journal entry is going to report. Leave cost and time blank. Step 7. Make sure your LHD is the default for the region. Step 8. Record a brief description in the output journal. You may click the View Smart Objective button to reference information in your work plan. Be outcome focused, telling what the outcomes were for the activity being reported and how you got that result, concentrating on the allowable events and activities described in the package guidelines. You can click Packages on the toolbar and select the package for which you are reporting to review package-specific information. Step 9. Enter the number of people reached in the appropriate audience category in the audience section. Step 10. Check the box for share this story if you wish to share your successes, barriers, and so forth about this activity with other LHDs. Step 11. Check the media generated box if the activity brought about any news stories, interviews, etc. as a result. Step 12. When you are finished, click Update to add the entry to the list at the bottom of the screen. Step 13. If you choose to end your entry without using the optional Key Partner and Media screens, click Update and then click Save. Step 14. With the exception of the Cribs package, the Key Partner screen is optional. It is used to document community partnerships, cash donations, volunteer activity, and other in-kind contributions if applicable. Documentation of any type of contribution is encouraged strongly. Step 15. You can enter additional partners by entering them in the blank text field next to Key Partner below Select. Step 16. Select Key Partner type from the drop-down list. For example, community, agency, individual, and so forth. Step 17. Select contribution type. Enter the dollar value, volunteer hours, and anything else that would be applicable. Step 18. Enter contact information. For example, contact name, email address, phone number, and so forth in the note box. Step 19. Click Update to add the entry to the list at the bottom of the screen. You can enter more than one partner contribution for the package by clicking New after you click Update, entering the data and clicking Update. Repeat until all partners are entered. Step 20. If you choose to skip this screen, click Next or Media on the left side of the screen to move to the next screen unless you are finished, in which case you will click Update and Save. Step 21. The media screen is optional and is used to document media activity, both paid, such as advertising on a bus wrap, and earned, such as a free radio PSA about the activity. Step 22. Click Update to add the entry to the list at the bottom of the screen. You can enter more than one media piece by clicking New, entering the data, and clicking Update. If entry is complete, click Save. If not complete, go to Step 23. Step 23. Click Next or Evaluation on the left side of the screen to move to the next screen. Step 25. Evaluation is the last output reporting screen. This screen is used to evaluate each package-related allowable reportable activity and event for all the packages. Step 26. You select a completion month. 27. Indicate whether or not you met the SMART activity objective in your work plan for this activity and explain why or why not. Step 28. If you would or would not recommend this activity to other contractors, explain why or why not. Step 29. Enter a policy outcome if it applies to the activity or event being evaluated here. Enter all other outcomes related to the activity. Step 30. Important. When you are finished, click Save to save the entire result for this activity goal combination. Another caveat. Evaluation page is only used when you're doing closeout. Please do not close out your packages until the end of the fiscal year. Thank you. Monthly expense report requirements. Make certain that all allowable events and activities are entered, current, and audience numbers are accurate in Cataylst. Step 2. After step number 1 is complete, enter a new output for each package as follows. Month reporting in the month box, total cost of doing the package for the month in the cost box. In the output journal section, enter the amount expensed for the month for the package for staff. The amount expensed for the month for materials, and the amount expensed for the month for in-state travel and any other expenses. The total that was entered in the cost box must be equal to the total of the cost breakdown in the output journal. Step 3. Enter the number of cribs distributed for the month below the budget report. It should look something like what you're seeing on the screen or in your user guide. This must be completed by the 20th of each month after your outputs events have been completely updated and saved for the reporting period. It must be done for each and every package on your work plan. The costs will be compared to what is reported to AFM to be reimbursable expenses for Cost Center 766 MCH. Okay, I'm going to teach you how to access the report that is used by DPH, MCH, and myself to review your activities and your budgets. Plan versus actual detail report shows package choices, work plan versus actual outputs, audience category numbers, and costs. This is useful to help determine what activities have been completed and what has yet to be done. It helps with planning what needs to come next in order to meet package goals. This is the report used by DPH, MCH to review activities and budgets. You're going to follow this path. Reports, outputs events reports, plan versus actual detail report. Enter your contract name, contract year, and click on the Include Smart Activity, Include Output Journal. Then click on Find to make sure that it's what you want down at the bottom. At the bottom, I want you to click on what you found, and there is the report. On page 27 of your user guide is Cataylst terminology. An activity is a program approach or strategy that is intended to achieve a short-term or intermediate outcome. In Cataylst, the categorical activities on the drop-down menus for MCH are the same as the names of the MCH packages chosen by the LHDs. The packages, what we call the activities, chosen by the specified LHD are indicated in the activities list with an asterisk. Allowable events and activities. These are the activities that are reportable. Each package has its own unique list of allowable events and activities, making it important that each package be read and understood before choosing it. These activities are the minimum required within each package and will be expected to be accomplished and reported in a timely manner. It is imperative that the MCH coordinator and any LHD staff that will provide the services understand those services, are able and willing to complete them as designed. Audience. These are the people for whom you provide MCH package-related services. There are 16 audience categories in MCH Cataylst. Each package guideline has a list of target contacts on the first page. These are the audience categories that should be utilized when reporting on any particular package. For example, coordinated school health audience category should be schools. Prenatal care tracking should be pregnant women. Contact, a local health department Cataylst user. Contract management, activities or services associated with the roles and responsibilities of the MCH coordinators. Contractor, a county health department or healthcare district. Event, the implementation of an activity. For example, printing of a newspaper article or teaching of a class is an event. Goal, the goal is the purpose toward which activities or packages are directed. Activities are organized by goal. Key partner, a contributing organization or individual, also known as a community partner. For example, a grocer who donates snacks, a stakeholder who contributes staff time, or an organization that contributes space to plan, host, or implement an activity. Outputs, indicators that demonstrate an event is complete within your activity work plan. Also describes and measures what was actually done. For example, the number of individuals who attended a class in current safe sleep standards is an output measure, whereas the term a class in current safe sleep standards is the description. Output reporting, recording and updating outputs or activities in the Outputs event screens of Cataylst. Output journal. This is the primary component of output reporting. Generally, journaling is a summary of work on a consistent and timely basis. SMART objective, a description of work plan activities that are specific to your LHD and population and communities, measurable, achievable, relevant, and time-bound. Work plan, the set of activities selected for implementation in your service area for a selected fiscal year. The next page in your user guide has a few helpful hints, links, and other resources for you to take a look at your convenience. And I highly recommend that you go on the links and review, at least briefly skim through them to see what's there. The last page of the user guide is the state MCH team contact list with the related programs and packages. If you have an issue with infant mortality, an infant mortality package, for example, you would contact Luann Cottrell. If you have an issue with a prenatal package, you would contact Trina Miller. If you have an issue with any of the coordinated school health or bullying prevention packages, you would contact Nicole. And if you have issue with fluoride varnish, you would contact Dr. McKee. Thank you for your attention. I hope that this is useful to you, and I hope that you take time to note your questions, because soon I'll be doing a training near you. face-to-face. Bring your questions with you. Thank you again. Have a great day.